COVID-19, directly or indirectly, numbered 19 million plus. At present, the pandemic is still haunting the world. Since the start of May, national pandemic response has been stable, with a continuous decline in the new confirmed cases. In all the provinces and in 21 provinces and Xinjiang Production and Construction Corp, these are low-risk regions. However, there is still the risk of relapse. We must uphold the principle of dynamic case clearing and never let down our guard, and make unremitting efforts to ensure all those that should be tested, quarantined, and treated must be tested, quarantined, and treated. Accompanied by NAT testing, transfer, quarantine, community control, and other major management to ensure that we can identify the risks as quickly as possible and curb onward transmission. We must earnestly implement the ongoing routine control measures to prevent people-to-people, object-to-people, or environment-to-people transmission. We advise the general public to have good personal protection and get vaccinated. As of May the 5th, across the country, more than 3.3 billion people have been vaccinated. 1,286,000,000 people have received full course vaccination. Today, we will focus on scientific and targeted prevention control measures, refine and solidify our methods of control. We have with us DG Wang Dengfeng from the Ministry of Education, Sports, Health, and Art Education Department. Mr. Song Yi, DG from the Department of Higher Learning from Ministry of Education, DDG Wu Liangyou from the Disease Control Bureau of National Health Commission, and Mr. Liang Wannian, head of the experts panel of the Pandemic Response Group with NHC. Now we will open the floor for questions. Please ask your questions and please identify yourself before you address questions. Thank you. With CCTV. In April, in our country, there has been a total report of 550,000 plus domestic infected cases. What is the situation in May? What will be the development trend? Mr. Wu Liangyou is taking the question. Thank you for your question. Since the middle of April, there has been fluctuated decline of the cases. Since the end of April and during the May Day holiday, the overall situation has been stable between the 30th of April and the 3rd of May. Daily new reported cases numbered 5,800, a decline of 80% from the plateau. In Shanghai, there has been continuous decline, and the situation is stabilized. The situation in Jilin province is tailing off, with the risks outside the quarantine places and the lockdown areas basically controlled. In Beijing, the district NAT mass screening and the screening of the close contacts have told that the onward transmission risk is on decline. In Nanchang of Jiangxi province, the situation is effectively controlled. However, we need to step up screening and control in Shangrao city of Jiangxi, in Liaoning, Zhejiang, Henan provinces. There have been some new cases with unknown sources. There is the risk of stealth transmission, and there is a bigger difficulty in the tracing of its origin and the control. In general, the situation is complicated and grim. There is still the risk of relapse. We must step up the locality risk control, improve the control measures and be prepared. During the May Day holiday, the National Health Commission, along with relevant departments, have guided localities to scientifically guide the general public to move in a safe and orderly way to minimize the risk of transmission because of a gathering. Going ahead, we'll continue to guide localities to solidify prevention control measures, implement the ongoing control efforts, and for places hit by local cluster cases, we will step up the screening, effectively control the risks, and curb the community transmission and consolidate the social fabric of defense. Thank you. With the cover, National Health Commission put it forward that we are now in the fourth stage of pandemic control. That is be scientific and targeted and dynamic case clearing. Compared with the previous stages, what is the major difference? Mr. Liang Wannian is taking the question. Thank you for your question. Since 2020, in our country, we've experienced the 4 stages of the pandemic control. The first stage was the stage for containment in face of emergency. Given the onslaught of the pandemic, it was a wall of defense. China has upheld the general strategy of preventing domestic transmission and imported, and we were preventing the transmission or spreading of the pandemic to the rest of the world. Within 3 months, we had the decisive success of defending Wuhan. We've won precious time for the rest of the world. We've also provided them with experience. The second stage was the stage of exploration of pandemic control with ongoing efforts. The general principle is preventing imported cases of domestic relapse. Given the sporadic cases and some locality cluster cases, we use the NAT testing as the key for preventing onward transmission. Within 2 to 3 incubation period, we brought the situation under control. In the third stage, it was the stage of the full chain targeted pandemic control with dynamic case clearing. In this stage, we emphasized acting quickly and targetedly in a precise way. We were acting in response to the Delta variant, and we adopted control measures. Within 1 incubation period, we could bring the situation under control. The fourth stage is the current stage, which started in May this year. We entered into a comprehensive prevention and control period featured by scientific targeted response and dynamic case clearing. Apart from the swift actions and targeted actions, we also emphasized the comprehensive actions across the board, including the control of the infection source, the cut off the transmission routes, and the protection of the susceptible population. With the combination of this array of measures, we acted swiftly and we adopted the most stringent, the most thorough, and the most resolute measures to curb community transmission. During the fourth stage, which is featured by scientific targeted control measures and dynamic case clearing, compared with the 3 previous stages, the prominent features for the fourth stage is first, its adaptiveness. In response to the features of Omicron variant, we've been optimizing the response measures. Based on the experiences of responding to Delta, we have adapted our control measures. In particular, we've been implementing the control measures to prevent people-to-people, object-to-people, or environment-to-people transmission. The second feature of the fourth stage is the swift actions. We've upgraded our measures to ensure early detection.
And also based on the high proportion of the Omicron variant with high asymptomatic cases, and it is highly secretive, we need to have a better monitoring on the fever clinic and also the testing of the priority groups. So all the positive cases would have to be reported immediately. Once there is such a positive report, it should be investigated. So we need to be very effective. So added by the method of NAT and antigen RTD, we would be able to move the defense line even one step ahead. And thirdly, we have enhanced our capabilities of the quarantine, because the Omicron variant would be able to generate large amounts of infected cases within a very short period of time. That is why we need to have ample preparations for the designated hospitals, makeshift hospitals, and quarantine centers to make sure that the capacity can be swiftly expanded when needed. And fourthly, we need to have a better treatment mechanism. According to the 9th version of the treatment plan, we need to have characterized-based treatment methods, especially for those who have underlying diseases and also the infected who are either senior or extremely young. And for those with no asymptomatic or light symptoms, they should be put into the makeshift hospital, and for those who are discharged can be put into the home observation as much as possible. So such minor mild symptoms or asymptomatic infected wouldn't really overwhelm the already overstretched medical resources. And fifthly, we need to enhance our measures in the treatment of the diseases. So we need to coordinate all the resources in the testing, the epidemiological investigation, quarantine, and treatment. And the community control should be put at a very important position. That is, we need to have the coordinations of the three publics, that is the public health workers, the police, and also those who work in the communities, so that the management of the venues with a congregation of the populations would be monitored in a more intensive way. For example, in the care homes or factories and schools and etc. So for the treatment of the diseases, a highly coordinated approach should be conducted, and centralized methods should be adopted. We should also make sure that the four parties' responsibility shall be implemented. The social community unit should be the division that can make sure that the targeted control can be fully conducted. We should also require that all the comprehensive hospitals, children's hospitals, and the women's hospitals would conduct such medical services as normal, and to have a very good medical service provided for the patients who have acute or chronic diseases. Thank you very much. I'm from Phoenix TV. Because the long term of the pandemic, the students may have some negative emotions, especially for those students who has been locked down in the university or the schools for a very long period of time. How can we provide better and professional psychological support and assistance to them? Indeed, especially for those universities or campuses which has exercised the lockdowns, indeed there might be psychological effects to the students. We need to classify two different types of categories. That is the emotion shocks caused by the lockdowns. This is quite natural, because if one has faced a very big adjustment to the routine life, then they would experience some psychological shocks. So for most of the time, the students may have a need to seek a psychological assistance and aid. So I believe that we can take the following measures. First of all, we need to adjust the lifestyle. So no matter the students who are locked in the campus or the mass public should treat it as a very normal phenomenon. For example, if you have to make some fundamental adjustments to your routine life, definitely you would encounter some difficulties. So this is the question that you would have to confront up to, first of all. And secondly, we need to make sure that the information can be disseminated on a timely manner, no matter it is the students who are locked down in the campus or the residents who are locked down in their own community. The reason why we would just exercise such lockdown should be communicated to both the residents and the students, so that such information should be known to the public. That is to say, everyone who is under a lockdown should know very clearly of why this measure has been taken and what types of adjustments should one need to take confronting such a situation. The reason that there is a psychological worry is because of the information asymmetry. They would ask the question why other universities or other communities are not in a lockdown like us, and why we are the ones who should be locked down in the campus or in the community. So such information should be disseminated to the mass public as much as possible. And also, there seem to be some rumors spreading. For example, there would be a managed control of the students or the campus, and the students would naturally ask, will the teachers also be imposed of exactly the same rule? That is, the students and the teachers would subject to exactly the same types of lockdown rules. So we would have to take into consideration that all the students as well as faculties and those who provide logistic services, actually people working at different job positions, when they are accessing the doors of or the entrances of the universities, clearly there would be a differentiated approach targeting on the people working in different job positions. So that is to say, we need to inform all the students and the teachers to have a clear understanding why sometimes differentiated policies would have to be imposed on the people working in different positions. For example, those who are working in the logistics who should be able to provide the supplies to the campus. And also, as Mr. Liang had mentioned, that many people would have a need to be provided with the healthcare, and in the universities, the students, especially who are going to graduate, would face the pressure of finding employment, and also some other students may have their special needs other than finding a job if they are not the students who will graduate. But anyhow, such rigid requirements would have to be provided. So other than stringently imposing such lockdown measures, other assistance should also be provided to the students who have special need, whatever kind it is. And also, when it comes to the learning, that is the online form, and also for some daily necessities like exercise and to have a shower in the public facilities within the campus, such types of needs should also be provided. No matter the food that we have provided or the quality of the online classes would have to be up to the standard. And also, if the students want to buy something, and then the prices of the products provided should also be stable.
And third, across the country, almost all universities have set up the psychological counseling center. They've also set up the hotlines for the students to call in. Apart from these routine styles of services, all kinds of diversified psychological services have been set up apart from the psychological counseling provided by professionals. The tutors, the class headmasters can also come and play a role so as to ease the tensions of the students. And all the faculty can come in and help. Sometimes those who are very close to the students can provide more effective service and help to students even better than the professionals. Besides, we should put up a comprehensive psychological service platform. At present, the Smart Psychological Service Platform has already set up a column for psychological assistance. All the psychological training courses for university students, middle school students, and primary school students have been put up. There are also some video clips and micro classes for psychological training. All these resources have been put online. There are also some targeted experts, lectures, and solutions. I believe these diverse resources can help to alleviate the tension and the anxiety. In the Huadong Normal University and Huazhong Normal University, we've put up some online courses and we've opened the hotline, and these have been greatly reviewed. We hope more psychological service centers from universities can join this online platform and provide services so that there will be more hands providing online support. Apart from all these efforts, we are also putting forward some online question and answer columns. Apart from making a call, you can also ask your questions online. Experts are organized behind the scene to provide answers in a lively manner. Of course, if it is a very private question, there will be one-to-one expert answer provided to these very private questions. And we have some technical solution to ensure privacy can be properly protected. So for all those who want to get some psychological help, they can either use the hotline to make a phone call, or they can also visit the question and answer column to see if there were similar questions asked before. Students and faculty can also come to the platform to just chat in the chatting room. All those negative mood can have an outlet, and all these will have their privacy protected. This is what we have been doing to the utmost of our efforts to ensure proper psychological help to the students and the faculty who are on lockdown. Thank you. With Xinhua News Agency, since March, many universities have adopted online teaching. What about the practice lessons, the laboratory tests, or experiments lessons? Mr. Song Yi from the Ministry of Education is taking the question. Thank you for your question. It's a great question, which is of common concern. Experiments and the hands-on lessons are important part of university teaching. Since the start of the pandemic, universities have been exploring online resources and virtual labs through MOOCs, the massive online open courses, and the live broadcasting virtual labs. Great experiences of exploration have been conducted. For example, in Nanjing University, online and offline teaching have been combined. The faculty has made some biology and chemical experiments MOOCs so that students can view the experiments online, and once the campus is opened, they can have hands-on experiments. Tsinghua University has sent and delivered the equipment for experiments to their students who are quarantined at homes, and they provide them with online guidance. In Tongji University, 52 virtual labs have been put on this online experiment space with more than 17,000 reviews. 56,000 person times have learned by using this virtual software. After 3 years of experiences, many universities have fully fledged experience in organizing online hands-on lab lessons. Starting from 2013, the Ministry of Education has already promoted universities to explore the development of online lab and experiment resources. In 2017, the Ministry of Education has selected 728 specialties of online courses. In 2018, online lab space platform was opened to provide virtual lab and virtual experiment services to the students, covering 61 specialties and altogether 3,250 courses. Since the start of the pandemic, this platform has played a major role in supporting the teaching of experiments. For example, 2,200 faculty were trained for the use of the online lab space. In Jilin Province, Jilin University, Yanbian University, Changchun Construction Academy, and Normal University have been using this online lab space with 160,000 person times of visits and reviews. In June, we will move into the second stage of development of this smart online higher education teaching. We hope all universities can better use the online virtual lab resources so as to meet the teaching and hands-on practice needs of the students and faculty during the pandemic period. Thank you. Next question, please. Thank you. With CRN. Since the start of this year, there has been a reoccurrence of the pandemic in border smaller cities, with major impact on their livelihood and life. So in remote border areas as such, how can we balance pandemic control and people's livelihood and life? Mr. Liang Wannian is taking the question. Thank you for your question. After we stepped into the stage of ongoing pandemic response, all cluster cases or domestic cases could find their overseas origin or imported cases. Therefore, we must step up our efforts in preventing imported cases so as to control the problem at the source, step up the risk preparation for the inbound travelers, the imported cold chain products, and to consolidate the fabric of defense. And therefore, we must focus on the following aspects. First, we must uphold the general principle of dynamic case clearing, improve the pandemic control mechanism in border cities. The border cities must have an ad hoc prevention control committee, and the leadership of the local interagency task force of control. All parties and departments must cooperate to ensure accountability, clarify the responsibility and people in charge on all the important links so as to better implement the control measures. In other words, we are no longer seeing the port city as a whole in the control. In well-equipped and well-conditioned border cities, we can have a zoned, risk-zoned approach to set up a buffer zone. Within the buffer zone, we have strict measures, and outside the buffer zones, we have the ongoing control measures.
Secondly, we need to enhance the capability building of the monitoring and the pre-warning system. So we would have prevention of the people-to-people, object-to-people, environmental-to-people infections. We also need to enhance the testing of the relevant staffs, especially for the ones who work in the high-risk jobs positions, and we also need to enhance the pre-warning from multiple channels. Thirdly, we need to enhance the prevention and the capability of disposal of the port cities, so we would be able to make better preparations of the healthcare facilities, the designated hospitals, fever clinics, and the grassroots level of the health institutions, so that we would implement the 4 musts. We should also try to enhance the coverage of the vaccination and to enhance the support of the information. And fourthly, we should also coordinate the containment response with that of the guarantee of the livelihood. We should also try to, through the hotlines, to answer to the concerns of the public, to guarantee the basic life of the people, to make our containment measures to have a kind of more warming temperature. Can you please give us the latest information of the vaccination rollout, especially for those over 60 years old? We would like to give the floor to Mr. Wu Liangyu. Thank you very much for your question. According to the State Council interagency deployment, NHC had guided the vaccination rollout in an active way until the 4th of May. Altogether, we have 3,349,720,000, covering a population of 1,286,000,000 and 49,000, with 1,251,000,000 and 42,000, and covering a population of 91.22% and 88.74% respectively, which is the coverage ratio and the ratio who have received the full course. And the booster course reaches 756,723,000, and the sequential vaccination reaches 31,758,000, and the vaccination for the senior over 60 reaches 226,810,000, and over 215,624,000 have finished the full course, covering a percentage of 82.23 and 81.63%. Respectively, that is the coverage ratio and the ones who have received the full course. And over 162,324,000 have received the booster course. We know that we are facing a very severe and challenging situation in the COVID response, and we know that the vaccination would have a very positive results for the prevention of the severe and diseases and fatalities. So currently we have a very orderly vaccination rollout for the booster jabs. We have a higher proportion among the senior population when it comes to the vaccination rate. We would further enhance the vaccination rollout, and to do a better job in this regard, we hope that all of the people would be actively cooperative and to get your vaccinations according to the procedures on time and in a timely manner. On the 29th of April, in the press conference, that it is said that Omicron has a feature of high transmissibility and high secretive as a nature. So that is why we would like to use space to exchange the time or space for time. So the community containment measures should be put front and center. Why would need to pay great attention to the community control? Actually, the principle of China is the adoption of the dynamic zero COVID policy. So the community is the front line for our line of defense. That is to say, as you know, some other countries has adopted the first line of defense is at the medical institutions. However, the community in China is actually the first line of defense, and it is also the basic units for the implementation of all the containment measures. That is to say, if the containment in the communities cannot do a better job, there is no possibility for the pandemic to be controlled here, just as water tap, if it cannot be closed at the source, then there will be always water trickling down continuously. So we would also need to take a zoned approach in the management. Not only we are going to have the high, medium, and low risk zoning approach, we also have the zonings of dividing into the lockdown area, managed area, and prevention area. So the communities will be divided into different zones based on the strategies that we imposed on such a zoning approach to the system. And thirdly, the COVID-19 response is a systematic mechanism. It is a people's battle, and it is a test for the governance system, the coordination capabilities, and the management capabilities. While it is also down to the concept of the containment measures. Because of the vast territory of our country and very big regional differences, the capabilities between different communities also varies. That is why sometimes the community containment might be the weakest link in some regions. And for the last 2 years of the containment experiences has fully shown if we can do a better job in the community COVID response, we can effectively cut off the transmission of the virus and to realize dynamic zero COVID policy as soon as possible. And how can we make a better job in the control? First of all, we need to have a very clarified response target, and all the implementation of the measures should be properly conducted. And secondly, we need to ensure the normal life of the people in the community. Thirdly, we need to mobilize all the public to actively participate in the response, and also some advocacy of the knowledge of the pandemic should be timely communicated to the people. Second big issue of how to do a better job in the community control is that we need to have a whole system of the containment and control. The four parties' responsibility should be fully implemented. And secondly, the community committee as well as village committee and public health committee and the volunteers' resources should be given a full play. And thirdly, the community should be divided into different divisions, and the officials in the community should take their own responsibility in their own respective regions. And fourthly, the roles of the grassroots medical workers should be given a full play. And thirdly, we need to enhance the capability of the COVID-19 response of the community. And the first point is that the training and the rehearsal source above, the contingency plans of the response control should be well conducted. And secondly, their performance and the assessment of the work conducted in the community should be better conducted. We should set up the so-called no pandemic or no case community. And thirdly, all the accountability measures should be put well in place so that the containment and the response measures that has been put in place in advance should be very important, especially in terms of the response to the sudden flare-ups. And fourthly, for those units whereby they have some high-risk groups, for example, the seniors and etc., we need to have prioritized resources targeted on some prioritized groups and regions. And fourthly, we need to provide better support to the staff working on the front line so that we can take all kinds of measures to provide all kinds of necessary support for the staff working on the front line so as to resolve all their worries, and we can also provide a guarantee for them to do a better job in this regard.
好，接下来请右侧区第一排靠过道第一位记者。
谢谢主持人。人民日报记者提问：学校是学生。
With people's daily, campus is the place with a high intensity of the students. Omicron is featured by secretive transmission and can be hardly detected at the earliest opportunity. Are there more targeted arrangements in campus prevention control? Mr. Wang Dengfeng is taking the question. Thank you for your question. This is a question very much under limelight. The Ministry of Education has been providing a lot of training to those in schools. Just now, Mr. Liang Wannian has given us an overarching introduction to our overall national response to the Omicron. Given its prominent feature of secretive transmission and difficulty in detection, as Mr. Liang has mentioned, early detection is a very important link in our overall response. On campus, in the education system, how can we better respond to the impact of Omicron? We emphasize a better job in the four following aspects. First, a good access control. We must have a stringent access and exit control of the campus door, campus gate, so as to minimize the possibility of the Omicron finding its way into the campus. This is one of the most important aspects of our control. That's why we have stringent identification check, testing of temperature, checking of health barcode and mobility barcode. So that is a very important aspect of our efforts. Second, a good management of personnel. Students and the faculty on campus, we have sound health monitoring. Students and faculty and those who live with them back in their homes. For all these, we have the health monitoring to ensure early detection. Apart from good personnel management, we also emphasize the healthy lifestyle education. We encourage students and faculty to have careful, scrupulous personal health protection. Recently, shortly, the Ministry of Education will publish some pamphlets and the poster boards to emphasize the importance of wearing masks and good hand hygiene. These are seemingly simple but proven effective measures in response to the pandemic. We will also step up, as always, the health education so that the students and the faculty can have a comprehensive knowledge as to where are the things that they should pay attention to. In response to the pandemic, some localities have been emphasizing the health tips for conducting healthy NAT testing, with more frequent NAT testing covering a greater group. For example, in Beijing, for several successive days, there have been the mass NAT testing. A similar scenario is happening on campus. So if you are to take an NAT testing, what are the tips that you should pay attention to? Besides, there are also issues related to the healthy lifestyle, the styles and patterns of learning and life, and all these should be better educated. Third, apart from the personnel management, we should also have a good management of objects. Inevitably, there will be links and exchanges within and outside the campus, including the delivery of the courier packages and parcels. So we should have the good control of all those parcels that are about to enter the campus. Apart from the objects entering the campus, we should also have a proper management of the garbage and the sewage coming out of the campus. So the management of the objects are equally important as the good management of personnel and good management of asset and access control. And fourth, we must be well prepared with a reserve of the emergency response preparedness. Once there is any infection on campus, we must quickly initiate the implementation of the emergency plan, which should have already been in place and should have been put on drills for several times. So this is in line with what Mr. Liang Wannian has mentioned, the features of our response in several stages of our country's response. In particular, the campus is a very special place with a crowded intensity of people, with a very close interaction with the beyond campus life. Therefore, all these four aspects must be well managed to ensure the campus can and the education system can safely safeguard the clean land and territory of the campus. With China Education TV, the May Day holiday was just concluded. Students and the faculty are going back to their campus. What are the measures that we should further step up for the sound campus prevention control? Should we continue with the health monitoring for the students and the faculty returning to universities and campuses? Mr. Wang Dengfeng is taking the question. I understand the journalists' interest in and concern about the management of the campus. And I understand that the worry comes from the fact that during the May Day holiday, students and faculty may on trips, and when they come back, there might be a higher risk. That might be the major difference for the post-May Day holiday management and prior to May Day holiday management. If there are students and faculty who left the campus and the city of domicile for a trip, there is the possibility that they may have traveled to the places of medium and high risk. And also for their family members who live with the students or faculty may have already visited some places of medium and high risk. That's why the Ministry of Education places great emphasis on the post-May Day holiday campus pandemic control. After students come back from the holiday, we do have more stringent health monitoring. Today is May the 6th, several days after the May Day holiday. According to the information we've collected so far, there hasn't been major impact on the campus safety because of the May Day holiday, but we'll continue with close monitoring. However, if students and faculty had a history of travel during the May Day holiday, we will check whether they have been to medium and high-risk places, whether their family members have been to places of such. If so, we will stringently follow the control measures to put those who should be put on quarantine and provide necessary health checking, health monitoring. That's the way we strictly implement the national control measures. Even for students and faculty who haven't traveled to medium and high risks, and even for those who stayed on campus during the May Day holiday, we do not exclude the possibility of a changing environment during the May Day holiday. That's why we ask all the campuses in the first week after the May Day holiday to have a more systemic and scrupulous health monitoring of the students and the faculty. So that's our arrangements for the post-May Day holiday period.
So, after 1 week of the May Day holiday, other routine COVID-19 response measures within the campus will still be carried out as normal. So we will have the last question. Thank you very much. From Hongxing News. Omicron variant has a feature of high transmissibility and it is highly secretive. After the outbreak of the Omicron, that many regions have adopted the whole region static management, it would definitely have a negative impact to the production and the life of the people. So under what types of conditions can we enforce a whole region static management? How can we do a better and targeted scientific COVID-19 response? The dynamic zero-COVID policy doesn't necessarily mean a whole region static management. Quite on the contrary, the so-called dynamic zero-COVID policy is trying to avoid the whole region static management. Based on the feature of the Omicron variant, on the one hand, we need to enhance a speedy, resolute, and thorough measures to be taken, and secondly, we need to enhance our targeted control measures so as to, in a very large extent, to balance the COVID-19 response with that of the normal social economic development and also the normal social life. We need to prevent imposition of arbitrary draconian measures and one-size-fits-all practices. We should prevent no action or slow action, while at the same time to avoid such arbitrary action or across the board too overbroad types of actions. So in principle, the early stages of the flaring up, there is no necessity to enforce such all-region static management. However, there is a very wide community transmission, and we do not have a very clear transmission line. That is to say, the ones who are infected couldn't be really traced back to its origins, and there are a high risk of a widespread transmission. We need to take into consideration of the features of the pandemic and the capabilities of the control and the economic development stages, as well as the features of the demographics in that region. Then the decisions can be taken whether such static management should be taken, as well as the coverage scope and the time for such static management, if it is to be taken. So we can see from all these the four earlies and the four parties' responsibilities. Effective implementation would be able to avoid the occurrence of the all-region static management. How can we do a better job in scientific and targeted COVID-19 response? We need to adopt the policy of the prevention of the case import and the domestic flaring up. We should also adopt the dynamic zero COVID policy. So on the basis of the adherence of the previous policies based on the features of the Omicron variant, the following work should be better done, covering the following aspects. First of all, we need to enhance the monitoring of the virus, and the so-called the monitoring is one of the most effective methods of finding the infected cases. The better monitoring job can we do, then the earlier the chances that we can have and to identify such diseases. We need to fully utilize the NAT and antigen RTD monitoring method to try to find and identify the infected at an earlier stage to prevent it from further spreading. And secondly, we need to enhance the preparedness for emergencies and also come out with various contingency measures facing different scenarios. So we should enhance the training and the rehearsals of the relevant personnel. So we should also step up our preparedness for the makeshift hospital, designated hospital quarantine venues. And we should also need to make sure that the residents in the communities can have a normal life, and we can also provide the necessary supplies to maintain their normal livelihood, so as we can use the space for time. And thirdly, in the COVID-19 response measures, so we need to have priorities. The community control should be put front and center. The risk group should be controlled at the earliest stage in the controlled area, and also in the disposal and the management in the NAT test, epidemiological investigation, transfer, quarantine, and community control. Such links should be coordinated in a very effective measure, and all the information should be disclosed on a timely manner to make sure that all the work requirements should be directed to the grassroots level at the earliest time possible. The last question. On the 28th of March, the National High School Smart Education Platform was launched officially. So what types of role does this online platform play during the processes of the online learning? Indeed, the launch of the Smart Higher Education Platform was launched on the 18th of March, and it is also one of the endeavors that we had for enhancing the quality of the online learning. After it is being launched for 1 month, it has been well received by the students and the faculty. Altogether, we have more than 10 million traffics logging online, and we have many courses that has been used, and this is the one-stop search for the wonderful subjects, which has provided such a one-stop service for the students and the faculties, and the ones has covered the US, Australia, Brazil, South Africa, and etc. We have covered more than 100 countries. We also have the traffic from altogether from 100 overseas countries, especially for the provinces like Jilin and Liaoning, who are hardest hit by the pandemic. Clearly, the online plan has played a very important role. For example, the Tsinghua University and Jilin University has coordinated together to set up over 10 courses for the undergraduate students for Jilin University University, which has provided high-quality resources for the students. Shanghai Transportation University has mobilized all the resources to provide services virtually, the cloud homework, as well as online teaching assistant and other types of online courses, has provided very lively and vivid classes to the students. And Shanghai Technological University has also provided such a hybrid of online and offline model. Well, according to the current statistics, all the higher learning education in Jilin, Liaoning, Neimenggu, and Shanghai has realized that online teaching, and Beijing, Hebei, Jiangsu, and Shandong has already changed some of their teaching to cloud. So the reaction capabilities of the universities in conducting online teaching has been greatly enhanced. They would be able to react to the sudden flare-up of the cases in a more efficient manner. And the smart platform also put forward more than 1,000 multi-language courses open to all the audience in China, but also across the world, which has its really very salient features. While at the same time, we also have the so-called MOOC, International Exchange Mechanism. Starting from 2020, each and every year we have held the MOOC Educational Conference. We also set up the first online education international organization, the World MOOC Online Teaching Alliance.
与在线教育领域的
And this has become a leading force in online education. At present, we are preparing the second stage of the smart higher learning platform. We will integrate content including virtual labs, textbooks, sports, art, and labor, and other aspects, so that in the future this platform will be more comprehensive with richer resources and better services. That will be considered as a golden class online. Going ahead, leveraging this smart higher learning platform, we will roll out pilots in provinces and universities. We hope localities and universities can better leverage these online resources, combine the hybrid teaching online and offline so as to support the pandemic education and deepen the educational sector reform during this new era. I'd like to thank everyone for taking questions. In the future, we'll continue to hold press conferences. Please stay tuned. With that, we conclude today's press conference. Thank you.